I see a lovely face, and that is Maisha. Would you like to unmute and introduce yourself?
Yes, good afternoon.
Oh,
Oh,
go ahead.
yeah, so my name is Maisha Jones, and I work for Henry Ford Allegiance Health as a community engagement director. I started my journey with the Collaborative Council back when there was a financial stability network. So I work with that amazing group of people to really focus on some initiatives here in our local community. And now I'm a part of the Collaborative Network, new and revised, and helping to support onboarding of new members. So I'm excited about that. And community activists.
Great. Thank you for that. Nice to see you.
Hi, everyone. This is Abby Davis. I'm the new coordinator of Teen Pregnancy Prevention. I'm here just to learn about the network. Michelle White, my supervisor, has told me a lot about it, so I'm excited to see how we fit into the whole process.
Thank you, Abby. Welcome.
Hi, this is Aaron L. Massey. I am the Nurse Case Manager's team lead from McLaren Health Plan, and we're involved to see how we can support you in your services and your collaboration as we try to do in every area that we service in Michigan. And we are in every county in the Lower Peninsula, so we do try to involve ourselves in something in every prosperous region. Thanks.
Thanks, Aaron. Thanks for being here.
Welcome.
Thank you.
Hi, this is Angela Watkins. Can you hear me?
Yes.
Okay. I'm Angela Watkins. I'm the Service Center Manager at Michigan Works Southeast. I too started with the Financial Stability Network.
Excellent.
Great. Thanks. Is there anyone else on the call that did not get a chance to introduce themselves? And
hi, my name is Jessica Hira. I'm the Behavioral Health Liaison for Jackson Health Network.
Welcome. Thank you.
so if that's everyone, we'll go ahead and get started. I think Amy will share her screen. Oh, I'm sorry. Did I miss someone?
Yeah, that's okay. I thought it was off mute and it was on. This is Rhonda Farrell Butler, Community Engagement Coordinator with the Jackson District Library. And I'm just because I was invited to just come and see what's going on and what's happening. And I used to be on earlier when it was the Jackson Collaborative Network as well. And it's good to see everybody, or talk to everybody.
That's right. Thank you, Rhonda.
So yeah, sorry if I started and we missed anyone. Feel free to also interrupt again if we miss you, because this is we would love it to be a conversation and not talking at you. So, so yeah, we will go ahead and get started. I think Amy is going to share her screen, and I will try and keep an eye on the conversation and participants if we have any people that come in, and we will adjust. We're good at that. So I'll have Amy share your screen and we'll start rolling.
Excellent. Thank
go ahead.
you. Yes. No, I'll kind of move into it. So I'm sharing my screen so I can't see all your beautiful faces anymore. And I'm going to apologize up front for anyone who does not have a screen, because I'll probably refer to some of the slides. We will be attaching the slides to the information hub so that you can access them later at another time. But I also want to make sure that people feel free to jump in and ask questions at any point. It's kind of like a presentation, but I also, as Sarah mentioned, want it to be a little bit of a conversation. And so if there's spots where you're not understanding, I can't see faces. So if there's a perplexed look, you have to cut me off and jump in and ask questions. So We will move through it. So I'm going to do a little bit of background about where the network has been to this point and the focus moving forward. So we started the network many years ago in looking at, we found that a lot of the work in Jackson County was siloed. So that left-hand side of the screen, we had individual organizations that were doing lots of great work, but not doing a lot of collaborative work. So we found that there was some duplicative work in the county and things. We had a couple agencies working on the same things and not even realizing that other agencies were also doing the work. So when the backbone first was formed, it was looking at pulling together the different organizations and the different themes of the work that was going on. And so it was a great support to look at doing logistics, meeting facilitation, setting up meetings, doing the meeting minutes. The backbone brought in some conceptual learning to some of the groups so that we could really partner with each other and learn some skills to work within the work groups, which was amazing because as a result of that, as I'm sure many of you experienced in your different work groups, there was great collaboration in Jackson County. And that's been a thing that has carried through even to our response with the COVID-19 and things. We had great partnerships and great collaboration going on. What we did, we got to a point within our work groups where we felt like we could use some more support from the backbone, and we wanted to really start moving the needle on some of the things that we were working on. So we reached out to all of the work groups and all the organizations and said, what is it you all could use from the backbone support that might help you advance the work? So we have this next slide where we've got effective group collaboration, and there were some fantastic things that were happening within the work groups. But we found that some of the work groups had stalled, and they said what we really could use in the backbone is some technical assistance where you could use some more expertise in coaching, project management. We wanted to make sure that we were sharing and measuring progress and some data analysis that would help in finding out where we're at and where we need to be. Communication and action learning. So that is the focus of the new backbone support that is available to all our network partners. And in the end, we're hoping for a result where organizations have capacity within themselves to start moving more strategy work forward. So rather than having the work happen within the work groups, we're hoping that folks can then bring that back into the organizations and change the systems within our county so that it's long-term system changes. So that's kind of a little bit of a background of what the backbone looked like up to this point and what we're hoping it to look like moving forward. So is there anything that was confusing, or did anything strike anyone as, okay, this is great, but where, or any questions at this point, I guess I should ask. I'm going to do these great awkward pauses. So Sarah, did you have anything to add to those?
Not really. I mean, it is, as a new person to this work and to the community, I found these slides and visuals really helpful, especially learning about all of the work that the work groups had done, all the things that had already been captured, and then also understanding like the collective impact model, right? And understanding the systems change piece where we can take the work that was done, not lose it, but maybe transform the way that people were working, and then take all that work back to the organizations. And if everyone doing the work together, but not in work groups, actually having it move the needle and the systems change ways. So I thought the way that these were grouped and the way you told it was helpful for me.
Good. Yeah. Yeah. And I think just in reflecting on this, I think the where the network has been up to this point is really foundational to the future of the network. So I know that some folks in the network have been a little bit confused about, well, what's changing or why is it changing? And I think that it's actually just getting a little bit more advanced. So what we've done up until this point has been amazing, and we've built great collaboration, and we've pulled together a lot of different people and partners, and looked at a lot of root causes and a lot of strategies. And I think this is just going to help us move forward in actually changing some of the systems that we live in. So I will move on. So the network model, so we've got kind of 3 buckets in the network model. The top bucket is organizations and partners. So we've got action that would be led by partners in the organizations. And then we'd align those with a shared agenda so that we all, folks in the network, all were kind of working towards some of the same aims and goals. And then bringing them back into the organizations. And then we would make sure we're tracking progress and continuing to communicate amongst each other, making sure we're looking at measures and learning and things like that. So that middle piece is the collaborative action and learning. And this is where we can be of support in making sure that communication between partners are happening. And collaborative problem solving related to the root causes would be, that's where Sarah and I can kind of lend some support to, and making sure that we're aligning the work that we're doing with some of the priorities that we've identified in the network. And then the network council and staff activities. So there is currently a network council, which is comprised of individuals from financial stability, health improvement, and cradle to career that have come together as a council. We also have some community partners on that council, and their role for that council is to make sure that processes and methods are in place to create and maintain conditions needed to support the collective impact. Sarah talked a little bit about collective impact prior to this, and that's kind of the role of the council, to make sure that that moves forward, and making sure that the network is sustained and that we are aligning with shared values, and then making sure we're monitoring progress and kind of working together. That's a little bit about that. So the shared measurement team has come up with, with input from the network partners, kind of an outline of our vision and values. So clearly our vision is to make sure that we are a healthy, safe, and thriving community. The network values are that we are just, we are engaged, and we are learning. And that kind of ties back into the 3 values of continuous learning, equity, and authentic engagement. Moves into the aims, so we're looking to make sure our basic needs are met, that we're safe, we're resilient, healthy, and then that last line of the goals. So those are the ultimate goals that would come from the work that we're doing within the network. So this is kind of a complicated picture on the right. We do have this attached to the network hub, so you can go back and look at it. But for many years that we've reached out to network partners, we've done a lot of work within the work groups to find out what our community is experiencing, where the barriers are. There's been a lot of empathic interviewing, a lot of work within organizations to just reach out to our customers, our clients, our patients, whatever it may be, to say, what are the barriers that you're experiencing? And it was probably hundreds and hundreds of outreach efforts in many different ways to gather the information. And we've come up with 14 root cause priorities or system change targets. And these are really kind of what our community has said that they're experiencing and where the problems might lie, really at the root of the problem. So rather than talking about outcomes of smoking or obesity, things like that, it's what's really at the root of the problem that we can try to look at addressing. So there's 14 of those. And then we had, as many of you know, or were perhaps in attendance, we had a network advance in the fall where we came together and looked at the root cause priorities and asked the network partners, where do you think you have leverage within your organizations or work that you're currently doing where you feel like I think we talked about 3 to 5 priorities that we thought would bubble up to say, all right, so we can't address all 14 all at once. The network said we can look at 3 to 5 that will kind of rally our efforts around for 2 to 3 years. And these are not set in stone, but this is what folks said. I think there were about 112 network members that we asked to give input on. And this is where network folks said, I feel like we really need this as a priority for our work group, or I feel like we really have great leverage already going within our community that we can really move our work toward this bucket or toward that priority. And so these are the 4 that kind of bubble to the top. Now I want to remind folks that these are not set in stone. These are what the network has decided, and that's all of the individuals in the network has decided that they think are important or can really align work with. So the one that rose to the top pretty quickly was that we're looking to make sure services and policies are equitable and benefit the most vulnerable populations. I think most everyone in our network would agree that that is something that is a priority for them, and that is something they want to start working on pretty quickly and making sure that we address that need. The second one that rose up, I think about 15% said that they want to make sure community members have the skills and assets and agency to get their needs met. And then the last 2 were that We want to make sure that we're improving trust between community members and service providers. That seemed to be a theme that came up across the board in all three strands. And then that community members and providers are knowledge about service systems. So these are the 4 priorities that bubbled up. They will probably change over time. Hopefully we'll eradicate these issues very quickly. But we might see that work really kind of gets, organizations from all 3 strands, financial stability, cradle to career, and the health improvement organization will kind of rally their efforts around these 4. And with a lot more hands and a lot more network partners, we'll be able to move things quicker and move mountains, like I'd like to say. So I'm going to stop for a minute and ask folks on the call what did you find most significant about the priorities that we have up on the screen? Or is there anything surprising, I should say?
I don't see anything that strikes me surprising. I think a lot of these are hot button topics right now, and so they're definitely timely.
Yes, thank you, Erin. I agree. And ironically, these were all identified way prior to COVID-19. And I think that's actually interesting because the root causes of what was already happening in our community were just magnified by what's going on these days. So.
I think, well, yeah, just as I continue to learn about the process where the root causes were selected and identified by members, and then what kind of bubbled up to the top. And then also understanding the work that the different work groups did. And I'm a big fan of like owning the messy transition piece, but like I hope that we all can like understand how work that was being done, right, like fits in here. And so it might look different now because some FSN members would be working next to CDC members, but they're working around a root cause issue. And I think that we can talk a little bit later about like ways that you and I can support those facilitation of connections and groups, but just kind of seeing the how the network support looks differently, but that the work is not lost. It just kind of like morphs around a root cause, right? So I thought that was helpful to know.
Yeah, and I'm excited too, because I felt like when we were working in the network as it was, like I wasn't super working in the health improvement piece. I didn't really know what was going on with cradle to career or financial stability as well. And I think we all had these same root causes that kept bubbling up in our work group. We all felt like we need to get improved trust between community members and service providers. And every strand kind of felt that. And yet we were all working within our own circles trying to address that. So I'm excited about the fact that we can kind of come together and all, all 3 strands, rather than, I felt like we got a little siloed when we were doing work as just education or just finance or just health. And it was interesting to see that in all of the strands, the same things were bubbling up. This is really where the barrier lied, whether or not you were trying to fix, poverty or health or any of the, education pieces. So I thought that was I'm excited about bringing everyone together to work toward the same root causes. Any other thoughts?
Rhonda, is it true that I thought you piped in, or is that false?
Did you say Rhonda?
Mm-hmm.
I did, yes.
No, I didn't pipe in. I was listening. But since I'm here, I will say that I am glad to see that some of the things that we had really talked hard about and we were really concerned and had very intense conversation about, it's good to see that those issues are here. And you or either Amy stated, we were ahead as we look at what the times are like now. Mm-hmm. So that's nice to know that we were moving in the right direction. So
See
I'm glad
smart
to see
we are?
that. Huh?
See how smart we are, Rhonda?
Yeah.
Well, thank you for sharing. I did not mean to call on you. If you did, I'm not usually that person, but I also sometimes I just talk and I don't want to talk over people. So, so thank you for sharing that.
You're welcome.
And Sarah, is there anything in the chat box? Feel free to also, I know it's hard. These Skype calls are so difficult and it's really hard. You don't want to interrupt someone talking and you don't want to butt in. And so feel free to type any thoughts and comments into the chat box and Sarah will be watching for that to make sure that if that's an easier way to communicate or ask questions, we're happy to do it that way too. I wish we were all in person and could chit chat about this because I think that's so much easier.
Agreed. But
Okay.
nothing new in the chat box. We're good.
Okay, so we'll move forward. So this is kind of where the backbone is at this point. So there are two collaborative network consultants, that's Sarah and myself, and we are available to provide advanced expertise and consultation to make sure that the processes are moving forward and making sure that organizations have capacity within them to make system changes. And we're going to explain that. Sarah's going to explain that a little bit later in the presentation, conversation, whatever you might want to call it. So she'll go through that a little bit more into really what that looks like and what we have to offer. In addition to that, we are looking to bring on to our team a communications and community relations specialist, as well as data and information specialist, because we want to make sure that we're continuing to communicate across all network partners. I think that's been really difficult since the network transitioned and then we all got shut down and put into our living rooms. I think we really want to make sure that that we're communicating amongst each other and keeping those relationships going. And then the data and information specialist, of course, will be helping us to look at metrics of where we're starting at and where we're ending at and how we're moving that needle. And it will be helping at looking at disparity work and kind of what's going on in our community. And then Sherry Butters is our network manager, and she is the fearless leader that oversees the backbone staff. And so that's a little bit about us. I think eventually we will be a team of 5, and right now we're a team of 3. So we're getting there, baby steps. Okay, so I'm going to pass the conversation. Actually, I should go back and stop for a minute and see if there are any other questions. But if does anyone have any thoughts up until this point or questions? So I'm going to pass this over to Sarah to talk a little bit about specifically what we both have to offer in our roles as consultants to all network partners.
Thank you. So I am going to talk about the 2 types of coaching and technical assistance. I might use TA for short. So just know that I mean technical assistance. But as I start talking about it, just know that like this is, we will actually end with kind of a big picture sort of support system that Amy and I and the future team will be offering. So there are 2 bubbles, I guess we could say. And in the way that we are developing the model is divided in 2 parts. And so as we move forward, we'll define universal as the general support that's open to all network members in alignment with root cause priorities. And then the targeted coaching and TA is a focused one-on-one support designed to build capacity of members to lead systems change efforts within their organization. And you'll see that we have it defined as targeted is a and I'll talk more about the how and all of that, but really it is specific and intentional and a way to build capacity for members to do the work in the organization, being supported by the coaching and TA staff of Amy and myself. So in the next slide, we'll break it down. The universal coaching and technical assistance. You will see that for both the universal and targeted, the what does have some overlap because we really, when we are increasing connections between members and resources, we're supporting continuous communication among members. It just might look differently between the universal and the targeted, how we do it. So in addition to those first 2, also under the what, we want to increase members' knowledge and understanding of network methods and frameworks. So we have listed the action learning, human-centered design, the root causes, the network values, and then increase members' knowledge of network structures and supports. And if we move into the how, this will show how we are going to support the universal piece. So again, this is open to all members and a universal support. So we are looking to offer an online learning community and discussion board that is peer-led and staff-supported. So one of these methods could be a Facebook group that perhaps our future communications person would facilitate, but right now, our group / Sherry, I believe, recently launched just like a place for members to virtually gather around these pieces, right? So highlighting member successes and then peer sharing and learning. I feel like there's such value in the different experiences that that members have around. I had this challenge with, a board member, and someone's like, "Oh my gosh, me too. Here's a resource," right? There's a piece that is so valuable in like the shared learning, and we want to capture that as much as possible. Even when we are available to meet in person, I think that many of us could probably agree that like having a virtual place to connect that is convenient is also helpful. Sherry was so thoughtful in the chat box, she linked the Facebook group launched today. I feel like we should have like some sort of launch party. Maybe that's what this is. Yes. So there is she put a link in the chat box. I believe a email or an announcement will be going out as well. But we have, we're going to put some information on there. Likely some e-newsletter content will be in there as well. Some things that Amy and I have like looked up, and just ways also for members to feel connected to each other. We also offer webinars and other e-learning opportunities, learning convenings aligned with root cause priorities, and we put virtual and or in person. So that's what we were talking about earlier. These really like, we don't want to excessively have meetings, right? But there is value in meeting, and there's value in relationship, and there's, Amy always talks about like saying hi or making small talk when you're hanging your coat up, right? Like there's value in these pieces of getting to know each other. We don't want to lose that or like feel like that's eliminated. We just want to do it with intent. And if we do aligning with the root cause priorities, we actually can make a larger change in the community when it comes to those systems change targets. The use of the Network Information Hub to provide access to information and resources. We're working on keeping that up to date. And then an e-newsletter to support continuous communication in alignment with network priorities. And then if we switch to the targeted coaching, so some of the what will be the same and the how will be different. Excuse me. So the what will be increasing connections between members and resources, supporting continuous communication among members, build and strengthen the capacity of members to lead and support systems change within their own organizations and in the community, assist members to assess their current organizational conditions in alignment with network priorities and create a plan of action, and provide one-on-one support to assist members with the implementation of the action plan. So you'll see that this is different in that this the support we are offering is really to increase the capacity of each member in their organization. So if there is, and we'll talk a little bit later, Amy has a great board game, a great example that kind of walks a hypothetical situation, how we can help and support, but it really is a targeted effort that is intentional and around a root cause. So if we go back and if we go one more slide to the how around targeted, there's a lot of intent based in this how. So there's a one-on-one support to assist members in the development and implementation of a targeted action plan aligned with root cause priorities. And we put some different ways that we can be in contact with each other, in person, phone, virtual. One-on-one coaching to assist the member in applying action learning concepts and frameworks. So we said, for example, there's a very comprehensive, lengthy action planning discussion guide that is really helpful. Human-centered design, we just put some examples there of some frameworks and concepts. We also included connecting members to appropriate resources, including other members, and we really want to highlight that piece because if we feel like other members are one of our, or maybe the best resource we have, right, when it comes to connecting members to other members, especially around a shared goal, a shared challenge. So we put that there. Technical assistance in alignment with member goals and network priorities, and a development and implementation of a coaching agreement to ensure shared expectations and accountability. So this sounds very official. It is definitely like something with intent. So if there is something in writing, then it really is a piece around, like, say, for example, Maisha is like, Sarah, I would like to enter into, a coaching relationship, and we agree on this thing. Yes, Sarah is going to reach out to me with 2 tools by this day, and Maisha, we're going to meet then this day, and we're going to talk about this. It really is it's an intentional relationship. It's more than universal coaching. The universal piece is kind of everyone come get what you can from benefit, and the targeted is really assessing you, like your organization, your current challenges. What can we do to help partner and have this relationship together to help move the needle forward? Maisha said that feels very authentic. Oh, that could not be there, because there's no better compliment, frankly, for me. So it is a piece, and I really appreciated. We hosted this same presentation on Wednesday, and someone had commented. But what if we make an agreement and we have this goal and we sign, right? Oh yes, we both agree to this thing, but then life happens and then a new challenge comes up, and actually the coaching agreement doesn't make sense. Like the goals are actually really different. We just want to be clear that this is a flexible thing. We are here to like partner and do the authentic good work together, and it will likely change. It's just a piece in there that, like, are you committed to this work like we are? I like, your time is valuable and ours is also. And can we do this work together, like in this authentic partnership? So hopefully I said that right. That's a lot of information. I did not pause anywhere. So I will pause now. I got really excited talking about it for a minute. And I don't know, Amy, if there's anything that I missed, any points in there that you want to make sure to fill in, and or other people can talk. But I just want to make sure that, and then this is the graphic that is a little tough to read, but is the kind of just the overall universal and targeted in a different world. Maybe these are a little bit closer together and overlap because the what is similar. It really is like connection and relationships and supporting, and then the how is different between the universal and targeted. And I'll stop there to see if I missed anything. Amy, feel free to pipe in, or if anyone has any thoughts. Is there like I appreciated Maisha's comment. If anyone else would like to type in thoughts, or if you would like to unmute yourself, and is anyone surprised by a thing? Is anyone can't believe what they heard? Is there any thoughts anyone would like to share?
I think it's amazing.
Who was that?
That's Amy.
Oh, okay. I see a wireless caller said that, but I was like, that sounded like Amy's voice.
Yeah, that was my voice.
And I did, I said it before too, I'm a big fan of like owning the kind of messy transition phase. I'm not a good pretender. I don't like to pretend that like everything is smooth and no one feels awkward, right? Because like right now, it was a thing, and the network changed, and we're just trying to figure this all out together. But I'm here to like be in the messy and to partner with you all as we figure it out together. So I just wanted to reiterate that point.
Hi, this is Jessica. I do have a question. Like, I feel like I understand what your role is with the network, but how can I even think about reaching out to you? What are the thoughts that have to go through my mind to say, okay, you know what, I need to call them?
That is a timely question because as we continue to like develop the process and roll it out, we're actually right now developing different steps that members can take to reach out. So we're thinking about ways like maybe in QuickBase, there's a link that says like, click here to contact Amy or Sarah. Likely on the virtual learning area, that could be, it is a Facebook page. I don't know if there will be something else also, but like there will be a way to contact us there. We have a lot of, the e-newsletter that sends out. We're also working on different ways to reach out to you to connect. And Amy and I were just talking about maybe reaching out to like the previous group. So like I couldn't even tell you the list of FSN members, but maybe there's like an email that goes out to the FSN members that says hello. So there are different ways we're thinking about reaching out and connecting, but we are developing that as we speak. If you have a thought in your mind, also please feel free to share it. But we are developing that right now.
This is Amy chiming in again. So I also think that hopefully as we start to roll out some universal things, we will be kind of looking at doing some learnings around some of the root causes. And I think if we're looking at the root cause of services and policies, it need to be equitable and benefit the most vulnerable populations. If we roll something out that's related to that, that might spark something that you can say, you know what? Now that I'm better understanding what the cause is that people are experiencing, I've noticed this in my organization. And at that point, you might say, oh, I wonder if Amy or Sarah can help me move this forward, or kind of get over this barrier, or this thing that we're getting stuck on. So I think hopefully as we roll some things out related to the root causes that we've identified, and really dig a little deeper, you might be able to see things within your organizations that you say, you know what, that actually happens here, and I might need a tool or some help to kind of move through that.
Thank you so much.
Is there anyone else that has any thoughts? Or we also know that sometimes people don't feel comfortable speaking up. We will be following up with you all after the presentation in different ways. So I know sometimes things need to marinate a little bit before you have some cohesive thoughts. Everyone operates differently, but we also wanted to make space for people if they wanted to chime in now or at the end. Please feel free. We welcome all the thoughts and feedback.
Okay, so here's my board game. I don't know why we call it a board game. It's so funny to me. But I'm a visual learner, and I like to see things like, so what is this really going to look like? So, I read a lot of words and I understand the words, but what might the process look like? So this is just kind of a way to show folks that every process is going to be different, and likely it's not going to be this nice, smooth, like, one level to the next. It's going to loop back around. It's going to zigzag all over. It's going to cut back into the middle. So it's going to be a lot messier. It should just be like, circles going everywhere. But it just gives folks an idea of, so, all right, what is this technical assistance really going to look like? What would the process be if I wanted to engage in this? So that first box on the screen is really that that the need is identified, right? So you might find within your organization that you're stuck on this, or when you're looking at root causes that you understand that that's an important thing and that's a real barrier for folks in our community. And, you kind of, you're like, okay, well, I'm going to bring them in and see if they can give me some tools so that I can kind of move this within my organization. And at that point, Sarah, I would meet with you and just kind of take a look at, all right, where's your organization at? Do you have board approval? Do you have manpower or capacity within your organization that you guys can really move this forward? And if all those are yes, we've got dedicated staff to this, and I know that, my board is on, in line with this, then we would start to develop that agreement that Sarah touched on a little bit. And again, like she talked about, it would be fluid, but it's really an accountability piece too, so that we can make sure that we're understanding what your need is. You make sure that, I might think, oh, well, she's looking for this, and we form that, and you're like, no, that wasn't what I wanted at all. So there's an accountability piece there, and it will change as the work moves forward, but just to make sure that we're on the same page. And then at that point, we would just be available in that relationship to make sure, okay, well, here's a tool that's related to this work. And maybe, you might want to connect with doing some team building before you come in to try to adapt this policy. We would have resources. And then we would make sure that y'all have, this an action plan or a plan moving forward. There's, a number of different ways you can do that. We have the action planning discussion, or what is it? The action planning worksheet. And we've used that.
It's a guide, something.
Guide, that's it, something. So the action planning we've used, I know I've used it within the maternal child health action team. So a lot of the groups were kind of working through that. And we would make sure that you've got what you need in place to develop that plan and to look at, is this, what is the problem? How do we know this? Look at measurements, things like that. We would make sure, as always, that we're using authentic engagement principles to make sure that you're really finding out the needs of the folks that you're working with. So we would almost be insistent that you're hearing the voices of those that are experiencing the problems before we're really moving forward. And then making sure that one of the root causes that we're looking to address is that one of the top four. Is that something that is significant? I think everyone can see the work or the organizational bumps in the road within those top four. And then we might just make sure, is there another thing that you need? Oh, well, that's, we would bring in tools as needed. And as Sarah mentioned before, we would make sure that there's other experts within our network that we would connect you with, or maybe potential partners. So maybe you're, a group that, you're YMCA, and you're saying, I'm really struggling to connect with, 12 and 13-year-olds, and I don't know. And when we say, oh, well, the TPPI group or the Teen Pregnancy Prevention group has a youth advisory board, let's ask them what's the best way to connect with them. Or so some of that would be making network connections to make sure that we're not reinventing the wheel every time we're trying to bring something out or accomplish something. So, and then we would help in making sure, like, okay, let's take this and take it out to a small group and see if this is working. We're all about, coming up with a prototype, rolling it out, see if it works. Nope, that didn't work at all. Let's take it back to the drawing board and adjust this strategy and make sure that it's going to work, because we have great intentions and grand plans, and we roll it out and it's absolutely not what they needed. So we'd make sure that we can then bring it back in and make adjustments as needed. And then continually checking in, making sure that the measurements are in place. We don't want to roll something out and say, did that work? I don't know. We don't know where we started, and we kind of don't know where we're ending. So we want to make sure we can track progress. And then making sure that what is it going to look like in your organization once this rolls out? Like, will it impact it? Will your clients or customers or patients feel differently? Will they know that it's working? And then, eventually in the end, we've got a plan that is developed and implemented, and the organization embraces it and moves it forward. The implementation piece is certainly something that's not always as easy as it sounds, but the development of the plan is usually the easier part. The implementation and adaptation of it, that's where it gets sticky. But we would be along partnering with you to make sure that we're pushing that forward and pulling teeth and making sure that works, and just kind of giving you tools that you might need to do that. And then eventually, the organization would seem very different. People would experience in different things. The barriers would be broken down, and the systems would be changed, and we'd all be having a little dance party at the end. So yeah, that's just a picture of what it might look like. And again, you might have a group that comes in, okay, we've got this work, we already have the work plan done, and there's been great work that's already been done up to this point in many of the work groups. So you might come back and say, all right, we've got this action plan, and this is what we want to do, and this is what we've identified. We just need a piece about, engagement. We don't know how to reach this group, and can you help figure out, what we need to do and, what steps we need to take for that. So you'll come in and out of the process at different times, but it'll be way messier than my pretty graphic. But luckily, Sarah and I will be along the road and partnering with you and making sure that we're moving things along. So I'm going to pause for a minute and ask again, we keep pausing and ask, was there anything new or surprising about this slide that you didn't anticipate? Or let me actually redefine that question. What is missing from this slide that you as network partners were hoping to get? So when you're anticipating this whole network transition and you're thinking about how it's going to look different and you're thinking about what my work group or my plan or my organization really was hoping to get, is there anything that we missed on this that you feel like could be helpful? And we have a quiet group. I'm going to ask now, what's your favorite part about this slide?
Dancing people.
Hello.
Hi.
Oh, this is Maisha.
Excellent.
So I think a couple things I really enjoy about this slide is really a lot of times we get into those spaces where we have questions and we know that there's people out there that can answer them. We just don't know who the right people are. So having that piece where really connecting us with our partners and the people who are doing this work with us will help prevent us from duplicating work. So when someone has already done that work and has had results, we could learn from them instead of, really wasting resources to do the same exact thing and get the same exact information. So I appreciate that. And then I can really appreciate like the check-in process. I mean, sometimes we have these really great ideas and we start moving in a strategy and we start getting into action and we don't really have that check-in process. So then kind of we just forget about something or get back to it later or, pandemic hits and then we forgot what we were doing before it even happened, so really just that check-in to keep us focused on the work that needs to be done.
Thank you, Maisha.
Sorry, this is Aaron. I accidentally hung up on the call when I was trying to unmute myself.
Oh. I thought I said something offensive, Aaron.
No, not at all. I was just going to tell you that my favorite part is the dance party at the end.
Thank you. It's my little attempt at humor. And I like to dance. Any other thoughts or favorites? We'll continue to have opportunity for questions and things like that. I think I kind of went through some initial thoughts, and then in moving through this process as we walked through it, did anyone have anything that said, I really hoped for this and didn't see it? And that may come along as well. I mean, you may, like Sarah said, sometimes things need to marinate, so you may need to sit on it, and you might go, you know what, this would really be helpful, or will be available. We certainly want you to reach out with us. We're going to be following up. The first thing we're going to be asking is, and I'm not going to put anyone on the spot at this point, but be thinking about your organization or strategies that you've been working on up until this point, and be thinking of where things might have gotten stuck. I mean, certainly the whole world got a little bit stuck recently. But be thinking, we're hoping to reach out and ask what is going on within your organization or within your work that that we might assist with, and we'll take a look and see. As
And then, oh, go ahead. Sorry,
no,
Amy.
no, I was just going to actually pass this over to you to follow up a little bit.
Yeah, so we'll end here and we have some next steps. And Amy had already kind of covered the first bullet point around just beginning to think about how your organization might benefit. And to someone else's, maybe Jessica's point around, I'm not sure if I could benefit, or, we'll working through all of that, and you will see invites from us. To the second bullet point shows that also we'll be following up with a short survey next week. It's the week of July 13th, just to follow up and any thoughts or feedback you might have from this presentation. I know sometimes if like things sit for a couple days or you have a weekend to think about it and you're like, oh my gosh, they totally forgot this thing. So there's an opportunity to submit feedback that way. And all network members will be getting the survey. It will not just be for people who attended these meetings. We really are looking for as much feedback as possible because we want to support you all in the way that is best for you. And then also remember that we do have the network communications being shared bi-weekly via email. I have been hearing that they're getting stuck in the spam folder. So I know it's not everyone's folder, but if you do go into your spam, you will perhaps likely see emails from us, and Amy and Sherry and I, and hopefully more people to be determined, are working hard to put together content and resources that could be applicable to you right now. They're very racially just and COVID focused, which are the temperature of the world. And so we want to acknowledge what is happening in the world and try and help you all as we do it together. So those are just some things to know. That's how we are moving next and what to expect from us next. And please feel free to email us at any time, even if you're like, I'm not sure if I could benefit. Can we have a conversation? So we're here and we're working on this and also available to you all. I don't know if there's anything else. Anyone has any thoughts, or Amy, if I missed anything?
No, I think you've covered it all. I just wanted to thank everyone for being on the call. It's Friday afternoon and the sun is starting to peek out. So I appreciate y'all getting on and finding out about what we have to offer and kind of the direction we're moving. And I'm excited to partner with folks and be of assistance.
Amy, is there a next meeting planned?
Well, at this point, we don't have work group meetings on planned at this point. I think we're going to try to adjust the work that we've been doing, say within our maternal child health action team or some of the work groups. We're going to try to adjust the way we're working to looking at really more of the root cause work. So we earlier in the presentation, we kind of bubbled up when we did some of the outreach in I'm going to acronym MCHAT, Maternal Child Health Action. We found out that the barriers really weren't about some of the strategy work that we were doing. So moving forward, I think we're going to probably be putting that on hold and looking at what are really the barriers that women in our community that, don't have care and things like that. How will that align with some of the root causes? So we found, women didn't know certain services were available. So we don't have really, some of the group work is on hold. And the ideal is to shift when we get back into the real world. We'll be shifting the work toward kind of gatherings around the root causes. And that's where I think, Erin, you can probably be joining back in at that point. Once we do some learnings related to some of those root causes, that's when I think we'll be able to be addressing not just women and children, but all of the different populations that are being affected. So we will be like Sarah. Go ahead.
I'm sorry. I was just going to say I'm safe to assume I'll hear something from you.
You will hear something. And that's where when Sarah mentioned, look in your email for, it won't really be specific toward work groups as much anymore. But be on the lookout for network communications that would come out. And also jump on that Facebook page, because that's where some of the groups will be posting what's going on within their groups, and that connection can come back up.
Okay, great. Thank you so much.
Thank you.
If if no one else has any thoughts, we'll end it. I know we're a couple minutes over. Thank you all for your time today. And
Sarah,
oh, I'm sorry.
sorry,
Yes.
this is Angela. I was wondering if some of the slides you had on there, I would like to take have some of that information, or if there was other information that I could take back to my director of our organization to see how, to explain to him more about the network and how it's here to support the community. So to see if we then can offer some form of financial support to the network.
Fantastic. Yeah.
We are state and federally funded like a lot of organizations, and we have a lot of rules and policies that we have to follow when it comes to the finance. But I would like some more information to take back to them to show the about or to tell them about the network and how it's going to support the community to see if we're able to support it financially.
That's great, Angela. Thank you so much. Will you tell me again your last name?
It's Watkins, Watkins.
Yes, I will. I wrote a note down, and these slides, this presentation is available. I'm happy to send it to all of you, and I will make sure to send the slide to you after the presentation. And I appreciate your initiative in taking it back. That's super exciting, helping spread the word.
Yes, thank you.
Thank you. Well, thank you all for hanging out with us
Yeah.
past time on a Friday afternoon. Really, like these are super valuable for us as we build relationships and move the work forward. And we're in it together. I look forward to working with you all again soon.
Thank you, everyone.
Thank
Thank
you.
you.
Have a good weekend, everybody.
You
You
too.
too.
Goodbye.
Goodbye.
Bye.